Hello and welcome to ACE's Anatomy Review course. My name is Sabrina Newton and I'll be presenting material on basic anatomy and kinesiology. As an ACE certified professional, my background lies mainly in personal training, group fitness instruction, lecturing at the college and university level, as well as presenting fitness workshops. On the behalf of ACE, it is my pleasure to present this material to you today. It is now time to move on and talk about the muscles of the trunk. We'll talk about 4 anterior muscles, meaning the anterior abdominal wall, which are the rectus abdominis, the external obliques, the internal obliques, and the transversus abdominis. And then we'll talk about one posterior grouping of muscles, and we'll refer to those as the Erector Spinae. First, the rectus abdominis. The rectus abdominis originates on the crest of the pubis and inserts on the cartilages of the 5th, 6th, 7th ribs and the xiphoid process. The rectus abdominis is the most superficial layer of the abdomen. As we can see here, it's running in a long vertical fashion, and people often refer to this muscle as the six-pack muscle because if you're lean enough, you can actually see the different sections of the rectus abdominis. The actions of the rectus abdominis include trunk flexion or forward spinal flexion when both sides of the rectus abdominis are contracting, as well as they assist in lateral flexion of the spine or the trunk. So when one side or the other contracts, it might assist in a side bending or lateral flexion of the spine. Exercise examples for the rectus abdominis include an abdominal curl-up, also known as a crunch. To demonstrate the abdominal crunch or ab curl-up, I'm simply going to flex forward at the thoracic spine, lifting pretty much my entire shoulder blade off of the mat. Now, I do want to say a few things about executing a proper abdominal curl-up. Many people, when executing this exercise, like to throw the hips into the action. So you'll notice as some people curl up, they're also doing a pelvic tilt. So not only is the thoracic spine flexing, but they're also engaging in the glutes and the hips to provide a posterior pelvic tilt. This decreases the effectiveness of this exercise for the rectus abdominis muscle group. So the best advice is to go ahead and keep the pelvis in neutral, and as you curl up, you've got a nice strong anchor to pull on for the rectus abdominis muscle group. The next layer of the abdominals is the external obliques. The external oblique originates on the borders of the lower 8 ribs at the side of the chest, interdigitating with the serratus anterior. The external obliques insert on the front 1/2 of the crest of the ilium, the inguinal ligament, the crest of the pubis, and the fascia of the rectus abdominis. As the illustration shows, the external obliques run in an oblique or diagonal fashion, starting at the lateral portion of the ribs, going downward, more towards the abdominal area. And at the top here, we see the interdigitation of the serratus anterior. Now, the actions of the external oblique involve an oblique action or rotation because of the way the fibers are oriented. And to overview all of the actions of the external oblique, we'll discuss contralateral rotation, which means rotation to the opposite side of the body. External obliques are also involved in spinal flexion, and they're also involved in spinal lateral flexion. To drive the point home about how the external obliques contralaterally rotate, I'll refer you to the skeleton here. Now the external obliques, again, originate on the outer ribs and come in toward the abdominal area in an oblique fashion. So when they contract and when they're involved in rotation, that means they're going to rotate the spine to the opposite direction of the body from which they're located. So in other words, the external obliques are going to contract, and this spine is going to rotate toward the right. The external obliques are located on the left side of this skeleton, and they're rotating the skeleton towards the right, or the opposite direction. It's also important to note that the internal obliques, which we'll talk about next, are also involved in helping the external obliques in their rotation. Examples of external oblique action include an abdominal curl-up, because remember, when both sides of the external obliques are contracting, they're also involved in forward spinal flexion, as well as an ab curl with rotation. So again, the basic abdominal crunch or ab curl involves just forward flexion of the thoracic spine. So just contracting both sides of the external oblique along with the rectus abdominis as the spine flexes forward. Now we can also involve rotation into this movement and call into play the external obliques. So if I'm going to move in rotation towards my left, then I'm actually involving my right external obliques. If I move in rotation towards my right direction, I'm involving my left external obliques. A mistake that people often make with this exercise is, as they're rotating, they allow the hip to rotate with them. So as you can see, my hip started to lift there. And again, that means that the pelvis is not acting as a very stable anchor. So keep the pelvis very neutral. Do not let it follow you as you go into your rotation, and you'll have a more effective line of pull for the external obliques. The next layer of anterior abdominal wall muscles are the internal obliques. They originate on the upper 1/2 of the inguinal ligament, anterior 2/3 of the crest of the ilium, and the thoracolumbar fascia. The internal obliques insert on the costal cartilages of the 8th, 9th, and 10th ribs and the linea alba. So in the illustration, as we try to view the internal obliques, we see that the external oblique has been cut away. So lying just underneath it is the internal oblique. In this picture, the internal oblique has been cut away as well. But what I'm trying to get at is the fact that the oblique fiber orientation of the internal obliques are actually in opposition to the external oblique muscle that's lying on top of it. So let me remind you again of the external oblique orientation. The fibers are running downward in this direction. Lying just underneath the external obliques, then, are the internal obliques, and their fibers are running in opposition. So what this means is, if the fibers are running in opposition, when the internal obliques contract and perform their rotation action, they're going to perform ipsilateral rotation. Ipsa meaning same side. So same side rotation. So in other words, when the internal obliques on the left side contract, then they're going to contribute to rotation toward the left. So the spine then, or the ribs then, will rotate toward the left. The rest of the actions of the internal oblique are similar to the external obliques, in that when both sides contract, the internal obliques contribute to forward spinal flexion, and then when one side contracts, they also contribute to side bending of the trunk. Exercise examples of the internal oblique include abdominal curl-up and abdominal curl-up with rotation. So here we are again, showing you the abdominal curl-up. Nothing's changed, it's just regular forward spinal flexion acting at the thoracic spine. But now that we're talking about the internal obliques, just keep in mind that both internal obliques are assisting in this flexion of the spine. They're both firing and I'm performing flexion. Now the rotation involved in an ab curl with rotation, such as this, same thing I showed you before, is going to call on the internal obliques for same side or ipsilateral rotation. For example, I am now rotating toward my right, and my right internal obliques assisted with the action. I'm now rotating towards my left, and my left internal obliques are assisting with that action. The last muscle we'll talk about in the abdominal wall is the Transversus Abdominis. It originates on the outer one-third of the inguinal ligament, inner rim of the crest of the ilium, inner surface of the cartilage of the lower 6 ribs, and the thoracolumbar fascia. The Transversus Abdominis inserts on the crest of the pubis, the iliopectineal line, and the linea alba. The Transversus Abdominis, as the name indicates, is oriented in the transverse plane, meaning the fibers run horizontally. Also, as you notice, as I described the origination and insertion of the Transversus Abdominis, a major portion of its insertion is in something called the thoracolumbar fascia. And fascia is just a connective tissue that ties muscles together and keeps them in their place. It also provides an efficient line of pull for some movements. So the Transversus Abdominis, oriented horizontally, has a major action of stabilizing actually the lumbar area, because it is inserted or attached to the thoracolumbar fascia. When the Transversus Abdominis pulls tight, its fibers are running horizontally. When it contracts concentrically, it actually pulls the fascia located in the lower back area and actually supports it and stabilizes the spine in the lumbar region. To give you another example of that, we can look at the skeleton. So if you imagine the pelvic area and the Transversus Abdominis, which is the deepest layer of the abdominal muscle closest to the contents of the belly or the guts, so to speak, we're looking at fibers that are running horizontally. So when the muscle contracts and it's pulling its origin and insertion close to each other, it's not necessarily moving any bony structure. What it's doing is it's just compressing the contents of the abdomen. So again, running transversely or horizontally, contracting and just really compressing the abdominal contents. So let's talk about the major actions of the Transversus Abdominis. One major action, as I just mentioned, is to compress the abdominal cavity. The next major action is to stabilize the lumbopelvic region. And that happens because it is attached to the thoracolumbar fascia, which runs in the posterior lumbar region. And finally, the Transversus Abdominis assists in forced expiration. So it can be a respiratory muscle if needed. One way that you can check this out on yourself is if you place your hands on the area of the Transversus Abdominis and perform a cough. When you cough, like so, you'll actually feel the lower abdominal muscles tensing, and that is in part due to the Transversus Abdominis helping with that forced expiration. An example of an exercise that calls into play the Transversus Abdominis is something we called the drawing in maneuver. And that simply means that you're drawing the belly button or the navel in towards the spine. some people describe it as sucking in your gut. However, I would move away from that terminology because it implies that you're straining to pull your guts in and therefore making it more difficult to breathe. Now, the Transversus Abdominis engagement, or the drawing in maneuver, is really used in all types of different exercises. Because anytime you're doing a weight training exercise, whether it's squats for the lower body, a lat pull down for the upper body, or even an abdominal crunch, it's important to engage the Transversus Abdominis to stabilize the lumbar spine. Finally, let's finish up the trunk and move to the posterior portion. I'm going to speak about the Erector Spinae muscle group as a whole, but please understand there are several layers and several muscles that make up the Erector Spinae. So in general, the origins and insertions of the Erector Spinae involve attachments at the spinous and transverse processes of the vertebrae to each other and to the pelvis, ribs, and skull. The Erector Spinae muscle group mainly are deep muscles, so they're lying underneath the larger muscles that we've already talked about of the posterior area. And many of them run vertically up and down the spine and are attached to the spinous processes, which are these processes that point out posteriorly. And these processes are what we think of when we actually think of our spine and actually feel the spine. It's these spinous processes that we're actually feeling. And they also attach to the transverse processes of the vertebrae. And the transverse processes are these projections that stick out laterally or to the side. So again, speaking about deep muscles that typically run vertically along the spine, and their main actions are extension of the spine. When both sides of these muscle groups contract, extension of the spine occurs. However, they're also involved in lateral flexion of the spine if only one side contracts. So lateral flexion or side bending of the spine if one group or one set of the Erector Spinae contracts. Now, exercise examples for the Erector Spinae include prone back extension exercises or exercises when you're on all fours, such as the bird dog. So the prone back extension involves lying in the prone position and initiating the movement using the Erector Spinae to lift the chest off of the mat and then eccentrically contracting the Erector Spinae as you lower the chest towards the mat. So as you can see, there's not a huge range of motion. However, this movement is effectively working the Erector Spinae. To make it more difficult, we can start to move the lever away from the spine. So if I were to place my hands near my head, I would have more weight to lift as I'm extending, and that would make it more difficult. I could also reach my arms out and make it even more difficult. One thing I'd like to point out is even though I'm contracting largely my thoracic area spinal extensors as I'm lifting the chest off the floor, I'm still actively able to engage my lumbar or lower back area spinal extensors because all of the fascia that these muscles are tied into tends to pull, and consequently the muscle groups all up and down along the spine come into play, even just lifting the chest off of the mat. So this tends to be a safer exercise for developing back strength versus trying to lift both the chest and the legs off. So keeping the legs down and just again lifting the chest tends to work more effectively for developing back strength. So now I'm on all fours and getting ready to show you the bird dog exercise. For the bird dog, you're simply going to extend opposing arm and leg, reaching out and then coming in. Now, the idea of this exercise isn't necessarily spinal extension, but it's spinal stabilization against a moving periphery, against a moving arm and leg. And one function of the Erector Spinae are definitely to hold your spine erect all day long, and they act as important postural muscles. So it's important to exercise those muscles accordingly. So you wouldn't use a lot of heavy weight or a lot of rapid active motion. It's typically very slow, controlled movement with minimal weight added. At this time, we're ready to talk about the muscles that act on the hip. We'll start by looking at 9 anterior muscles. And those muscles include the iliopsoas, the sartorius, the rectus femoris, the tensor fasciae lata, the pectineus, the adductors, including the longus, brevis, and magnus, as well as the gracilis. And I'm orienting them anteriorly just because in a diagram, or when you're looking at someone in a neutral anatomical position from the front, it's easy to see those muscles viewing them anteriorly. It doesn't necessarily mean that they're all grouped in an anterior compartment. We'll also look at 9 posterior muscles that act on the hip. The 9 posterior muscle groups are the gluteus maximus, the gluteus medius, the gluteus minimus, and the 6 deep lateral rotators, which include the piriformis, the gemellus inferior and superior, the obturator internus and externus, as well as the quadratus femoris. Let's begin with the iliopsoas. The iliopsoas actually consists of 2 separate muscles, the psoas major and the iliacus, but it is often referred to as one muscle because of the similarity of actions of the 2 muscles. The iliopsoas originates on the inner surface of the ilium, base of the sacrum, and sides of the bodies of the last thoracic and all of the lumbar vertebrae. The iliopsoas inserts on the lesser trochanter of the femur. As our diagram shows us, after we peel away the layers of the abdomen, we're looking very deep into the lumbar and hip region. We can see the psoas major as well as the iliacus muscle. Both of these muscles come down and insert into a common tendon onto the femur. What I want you to notice about the iliopsoas muscle is that it's actually associated with the lumbar spine. It originates on all of the bodies of the lumbar spine as well as the last thoracic vertebrae. This has important implications in all activities involving the trunk, and we'll get to that in a moment. But let's talk about the actions of the iliopsoas. The major action of the iliopsoas is flexion of the hip. It's also involved in external rotation of the hip. Exercise examples that call into play the iliopsoas include the bicycle abdominal crunch, as well as a knee tuck. To perform the bicycle abdominal crunch, you're simply going into a bit of spinal flexion and then adding rotation with the legs extending out. Now, the reason the iliopsoas is involved in this movement is because every time the leg moves away from the trunk and then moves back in, the iliopsoas is causing that action, eccentrically helping to lower the leg, concentrically contracting to help bring the leg back in. Now, an important issue, and I spoke about it earlier with regards to the origination of the iliopsoas on the lumbar spine, is that many people with inadequate abdominal strength will perform this exercise and allow the lower back to pull away from the mat as the leg lowers. This is incredibly stressful on the lower back, the lumbar spine area. So if you're noticing a client cannot stabilize and keep a very neutral position as the leg goes in and out, then this exercise is definitely too advanced for that client. And really anything or any exercise that has the legs hanging out here in space is very stressful on the lower back if the client cannot really keep the neutral spine. If it arches off the back, you're asking for trouble. You're asking for lower back pain or aggravation of lower back pain. The other exercise that we discussed, or that I mentioned, was the knee tuck. This is also known as a reverse abdominal curl, where you're simply flexing the lumbar spine, pulling the hips off the mat, and tucking the knees in toward the chest. Now, this action definitely involves the abdominals, but keep in mind the action of flexing the hip is involved, which calls into play the hip flexors. Also, the hip flexors are involved just to hold the thighs in this upright position, holding them up against gravity. The next muscle of the hip is the sartorius. The sartorius originates at the notch between the anterior superior and anterior inferior spines of the ilium. It inserts in the anterior medial condyle of the tibia. What I'd like to point out about the sartorius is that it's a very thin, long strap of a muscle. So, originating up here at the hip area, crossing the hip joint, and also crossing the knee joint to the medial tibia. Because of its long, strap-like orientation, it's not a very powerful muscle, but it does assist with several actions. So the sartorius muscle actions are hip flexion, external hip rotation, and knee flexion. Sartorius is actually a Latin word meaning tailor. A long time ago, tailors used to sit in this cross-legged position to perform their duties. Therefore, the sartorius has been given the name for the tailor's sitting position. If you ever want to remember the actions of the sartorius, all you need to do is sit down in a cross-legged position, and you can see that the hip is flexed and externally rotated, and that the knee is flexed. The next muscle we'll speak of is the rectus femoris. The rectus femoris originates on the anterior inferior iliac spine of the ilium. It inserts into the tibial tuberosity via the patella and the patellar ligament. The rectus femoris is a very superficial anterior upper thigh muscle located right here as the diagram shows. The rectus femoris is actually one of the 4 quadriceps muscle groups, but I'm including it here because it's the only one of the quadriceps muscle group that crosses the hip joint. So the actions of the rectus femoris then are hip flexion as well as knee extension. An exercise example that calls into play the rectus femoris would be a supine leg raise. So a supine leg raise involves keeping the legs straight and lifting, promoting hip flexion and knee extension. Now obviously other muscles are involved in this action, but the rectus femoris is definitely called into action because the knee is extended during hip flexion. Next, we're ready to discuss the tensor fascia lata. The tensor fascia lata originates in the anterior iliac crest of the ilium. It inserts into the iliotibial band of fascia, about 1/4 of the way down. So looking at our diagram, you can see that the tensor fascia lata itself is a relatively small muscle embedded into a large band of fascia called the iliotibial band, and this runs down the lateral portion of the hip. The muscle itself is literally embedded into this fascia, or this tendinous material. Due to its orientation at the hip, the tensor fascia lata is involved in hip flexion as well as internal rotation. One position that calls into play the tensor fascia lata so that you can easily palpate it on yourself is to lie in the supine position, flex at the hip, and internally rotate the thigh. And it's this band of muscle that pops up upon doing those two actions, hip flexion with internal thigh rotation. Next, moving on to the pectineus. The pectineus originates in a space 1 inch wide from the front of the pubis just above the crest. It inserts in a rough line leading from the lesser trochanter down to the linea aspera. You can see the pectineus in its anterior view in the superficial anterior, somewhat medial thigh. It's lying just underneath the sartorius muscle, which we talked about earlier. The actions of the pectineus involve flexion of the hip and adduction of the hip. An exercise example that would work the pectineus would be standing hip adduction with slight hip flexion. So as you can see, I have resistance attached to my ankle, and I'm just crossing the midline, performing hip adduction. And in order to cross over the midline, I have to be in hip flexion. So this is actively working the pectineus. Now we're ready to move on to the adductor muscle groups. We're going to speak about the 3 adductors, the adductor brevis, adductor longus, and the adductor magnus. The adductor brevis originates on the front of the pubis, just below the origin of the longus. The insertion of the adductor brevis is the lesser trochanter of upper 1/4 of the linea aspera. The origin of the adductor longus is front of the pubis just below its crest. The insertion of the adductor longus is the middle 1/3 of the linea aspera. And finally, the adductor magnus originates on the edge of the entire ramus of the pubis and the ischium and the tuberosity of the ischium. The adductor magnus inserts the whole length of the linea aspera and inner condyloid ridge. As we view the diagram from the anterior view, we can see the adductor brevis, longus, and magnus, making up the anterior medial portion of the upper thigh. I do want to point out a few things using the skeleton here to help orient you with the pelvic region. First, you'll notice that the pelvic region is made up of a combination of bones. Now, we have these wing-shaped bones. These are called the ilium. And we also have a pubic bone, which is more anterior. And then we also have the ischium, which is inferior and posterior. And the ischium, namely the ischial tuberosities, are the actual bones that we sit on when we're in the sitting position. So when I was just describing the adductor muscle groups, they are originating from the pelvis and the ischium, the pelvis, or the pubic bone, I'm sorry, the pubic and the ischium, and then inserting along the femur. One aspect of the femur that I want to point out is called the linea aspera. And the linea aspera is a roughened ridge all along the posterior aspect of the femur. So as you can see, the adductor muscle groups originate in the pelvic area and then insert somewhat posteriorly on the femur. The major actions of the adductor muscle groups are, as the name implies, adduction. An example of an exercise that works the adductor muscle group would be a side-lying straight leg adduction. So to demonstrate the side-lying leg adduction, we're going to lift the bottom leg, bringing it into adduction. Now, the difficult thing about this exercise is keeping the hips stable and neutral. Once this bottom leg starts to adduct, the natural tendency is to roll back so that the hips are more rotated and now facing the ceiling, which is incorrect. We want to keep the hips stacked one on top of each other and just perform true adduction of the thigh. And to finish with the anterior muscle groups, we'll discuss the gracilis. The gracilis originates on the inner edge of the descending ramus of the pubis. It inserts in the anterior medial surface of the tibia below the condyle. So similar to the sartorius, the gracilis is a long, thin strap of a muscle. On the diagram, we can see it here, running down the medial aspect of the thigh. Also, like the sartorius, the gracilis crosses both the hip joint and the knee joint, so it has several actions. Most importantly, the actions of the gracilis are adduction of the hip and flexion of the knee. An exercise example that works the gracilis is side-lying leg adduction with a bent knee. We are now ready to move to the posterior aspect of the hip. First, let's talk about the gluteus maximus. The gluteus maximus originates on the posterior 1/4 of the crest of the ilium, posterior surface of the sacrum near the ilium, and fascia of the lumbar area. It inserts at the gluteal line of the femur and iliotibial band of the fascia lata. We can see on the diagram that the gluteus maximus covers a rather large surface area of the superficial posterior hip. Also notice that the gluteus maximus runs in somewhat of an oblique direction and is somewhat of a fan-shaped muscle. We can see that it has its ties in the sacrum area as well as insertion into the iliotibial band that we discussed earlier when we talked about the tensor fascia lata. Now, the main actions of the gluteus maximus are hip extension as well as external rotation. An exercise example that works the gluteus maximus is the prone straight leg lift. So to perform this exercise, you're lying prone and your head is resting on the back of your hands to keep the neck in neutral alignment. Then you're simply going to lift the leg, keeping it straight, engaging the gluteus maximus to perform this activity. You may also call into play the external rotation of the gluteus maximus if you just open the leg a little bit wider and lift in this position as well. Now, the thing to be careful with in this exercise is as the leg is lifting, be careful that you don't get into an exaggerated lumbar lordosis or curvature of the spine. You want to keep the front of the hip surface in contact with the mat, and you're just lifting the thigh with a straight leg off the mat. Now we're ready to discuss the gluteus medius and minimus. The gluteus medius originates on the outer surface of the ilium just below the crest. It inserts in the posterior and middle surfaces of the greater trochanter of the femur. The gluteus minimus originates on the outer surface of the ilium below the origin of the gluteus medius. It inserts in the anterior surface of the greater trochanter of the femur. On the diagram, we can see the gluteus minimus and medius if we look posteriorly at the hip. Now, the medius is located somewhat superficial and as you can see from the diagram, slightly above the gluteus maximus. Here's the gluteus medius. To look at and view the gluteus minimus, we actually have to cut away the gluteus medius and maximus. So here we are viewing the gluteus minimus, which is a deep muscle of the posterior hip. Now, I lumped the gluteus medius and minimus together because essentially they perform the same action, which is abduction of the hip. I do want to point out that they have other functions, especially in the human gait cycle. They're very important for stabilizing as we shift the body weight from one foot to the next in walking. I believe that's a little bit beyond the scope of this video today, so I'm just going to address the abduction of the gluteus medius and minimus. An exercise example that involves the gluteus medius and minimus is side-lying leg abduction. I'm ready to now demonstrate side-lying leg abduction or side-lying leg lift. Here, I'm lying on the side with the hips stacked right on top of each other and the pelvis in a neutral position, and I'm just going to lift the top leg or abduct the leg and lower. Now, it's important to notice that I'm not lifting too terribly high. What happens when people try to do this exercise, typically they try to lift as high as they possibly can, which causes external rotation and the hips to roll back. So being careful that doesn't happen is very important. So just advise your clients to keep the hips parallel, stacked right on top of each other, the knee facing forward, and just doing true hip and leg abduction. We're now ready to talk about our final posterior muscle groups, the 6 deep lateral rotators of the hip. And again, these include the piriformis, the gemelli, the obturators, and the quadratus femoris. The piriformis originates on the anterior surface of the sacrum and inserts on the greater trochanter of the femur. The gemellus superior originates on the posterior ischium and inserts on the greater trochanter of the femur. The gemellus inferior originates on the ischial tuberosity and inserts on the greater trochanter of the femur. The obturator internus and externus originate on the obturator foramen and insert on the greater trochanter of the femur. And the quadratus femoris originates on the ischial tuberosity and inserts just below the greater trochanter of the femur. I've grouped together the 6 deep lateral rotators of the hip because they all perform the similar function. However, I do want to point out on the diagram that the piriformis muscle, which lies above the other deep lateral rotators, right here, as you can see the piriformis, is the only deep lateral rotator that originates from the sacrum. The other 5 deep lateral rotators actually originate from the ischium. And this is important because the sciatic nerve, which is the main nerve of the lower body, originating from the sacral area, is lying in close association with the piriformis. Sometimes, in some individuals, it even pierces the piriformis and runs through it. This is important because people who have an irritation in this posterior lateral hip area, whether it's due to faulty body mechanics or poor posture or repetitive movements such as cycling, can have an irritation of the sciatic nerve as well, which causes a numbness, pain, or maybe radiating pain down the leg. So I just wanted to point out that the piriformis is directly associated with the sciatic nerve. And as the name implies, the function or the main action of the deep lateral rotators is external rotation of the hip. And by the way, lateral rotation is the same thing as external rotation. An example of an exercise that works the deep lateral rotators of the hip would be side-lying external hip rotation. So for side-lying external hip rotation, keeping the knee flexed and just rotating the hip in an outward direction is all that's necessary. Having the feet anchored and just opening the legs, again, helps stabilize and helps make this a more efficient action. One thing to be aware of, again, as with other side-lying exercises, is that there is a tendency for the participant to either roll back in this position or to slouch and allow the shoulder stabilizers to relax. So make sure that the trunk stabilizers, shoulder stabilizers, pelvic region stabilizers are all acting so that this function can be performed very efficiently. It is now time to look at the muscles that act on the knee. We'll talk about 4 anterior muscles, namely the quadriceps. So the rectus femoris, the vastus intermedius, the vastus medialis, and the vastus lateralis. Then we'll talk about 3 posterior muscles, namely the hamstrings group, which are the biceps femoris, the semitendinosus, and the semimembranosus. First, let's talk about the quadriceps, the rectus femoris, and the vasti muscles. The rectus femoris originates on the anterior inferior iliac spine of the ilium and inserts into the tibial tuberosity via the patella and the patellar ligament. The vastus intermedius originates on the upper 2/3 of the anterior surface of the femur. The vastus lateralis originates on the greater trochanter and lateral lip of the linea aspera, and the vastus medialis originates on the whole length of the linea aspera. All 3 vasti muscles, along with the rectus femoris, insert into the tibial tuberosity via the patella and patellar ligament. As the diagram shows, the quadriceps muscle group is located on the superficial anterior aspect of the upper thigh. In this diagram, the quadriceps remain intact, with the rectus femoris on top, the vastus lateralis on the lateral portion, the vastus medialis on the medial portion, and the vastus intermedius, we have to actually look on the other side because it lies underneath the rectus femoris. And here we can see the rectus femoris has been cut away. The main action of the quadriceps muscle group is knee extension. And remember, one of the muscles, the rectus femoris, is also involved in hip flexion. An example of an exercise that works the quadriceps muscle group is seated knee extension. The seated knee extension is typically done on a knee extension machine, but it can be simulated with elastic tubing. So in the seated position, simply extending the knee and then releasing. So concentrically contracting the quadriceps muscle group to extend the knee, eccentrically contracting as the knee comes out of extension. Now some machines or some positions call into play the rectus femoris a little more. For example, you'll notice that if you lean back, or if you are sitting in a machine that allows you to lean back, you're actually pulling yourself out of hip flexion, and more of the rectus femoris gets to come into action here. Either way, all of the muscles of the quadriceps are still contributing to knee extension. Next, let's look at the posterior muscle groups that affect the knee, namely the hamstrings. The biceps femoris, the semitendinosus, and the semimembranosus all make up the hamstrings muscle group. The biceps femoris, as the name implies, has 2 heads. The long head originates on the ischial tuberosity, and the short head originates on the lateral lip of the linea aspera. The long head inserts on the lateral condyle of the tibia, and the short head inserts on the head of the fibula. The semitendinosus originates on the ischial tuberosity and inserts on the medial condyle of the tibia. And the semimembranosus originates on the ischial tuberosity and inserts on the medial condyle of the tibia. On the diagram, we can see the hamstrings muscle group in the posterior upper aspect of the thigh. We can see the biceps femoris is positioned more lateral. This is the muscle group running here. Slightly medial, we see the semitendinosus, which is so named because of its long tendon, resting here on top of the semimembranosus, which you can see there. You can also see the semimembranosus underneath here because the biceps femoris and the semitendinosus has been cut away. Now, the main actions of the hamstring's muscle group include knee flexion, and they're also involved in hip extension. Remembering that the hamstring's muscle group is a two-joint muscle. It does originate from the ischium, and it does insert either on the tibia or the fibula, which crosses the knee joint as well. So exercises that are examples of work for the hamstring's muscle group include either a standing, seated, or lying hamstring curl. I'll demonstrate a standing hamstring curl. I have resistance or elastic around my ankle, and I'm simply going to stabilize my trunk as I curl or perform knee flexion. One mistake that people make when they're performing hamstring curls against resistance is they tend to let the lower spine or the lumbar spine come into hyperextension. It's just another form of cheating the mechanics of the exercise. So again, that's incorrect, and it's very important to keep the abdominals engaged and just perform true knee flexion without any movement of the pelvic region. We're now ready to address the muscles that act on the ankle. We'll look at one anterior muscle, the anterior tibialis, and we'll look at two posterior muscles, the gastrocnemius and the soleus. First, the anterior tibialis. The anterior tibialis originates on the upper two-thirds of the lateral surface of the tibia and interosseous membrane. It inserts at the inner surface of the medial cuneiform and the first metatarsal. As mentioned in the description of the tibialis anterior's origins and insertions, it is attached to the interosseous membrane. And the interosseous membrane is a thin covering of connective tissue that connects the tibia and the fibula bones together. The main action of the tibialis anterior is ankle dorsiflexion. An exercise that calls into play the tibialis anterior is seated dorsiflexion with resistance. To demonstrate seated dorsiflexion, I've wrapped elastic tubing around the dorsal or top of my foot. Simply moving through dorsiflexion calls into play the tibialis anterior. Now, because of its action in running and sometimes fast walking, the tibialis anterior takes a beating and is associated with shin splints. This is an excellent exercise to help strengthen the tibialis anterior, to help people prevent shin splints or recover from recurring shin splints. Now we're ready to move to the posterior aspect of the lower leg and talk about the gastrocnemius. The gastrocnemius is a two-headed muscle. Its origins are the medial and lateral condyles of the femur. It inserts on the calcaneus via the calcaneus tendon, also known as the Achilles tendon. The gastrocnemius is the superficial two-headed muscle located in the calf area. The two heads can be seen nicely here in the diagram. Also, you might notice that the gastrocnemius is really a two-joint muscle because it originates on the femur and inserts on the calcaneus, therefore crossing both the knee and the ankle joints. The main actions of the gastrocnemius muscle are plantar flexion as well as knee flexion. An exercise example that works the gastrocnemius muscle group is a standing heel raise. To demonstrate the standing heel raise, the starting position is with the heels hanging off the edge of a step. Once in position, I'm just going to roll on the balls of my feet, go into plantar flexion, elevate the heels, and then lower back down. Hanging off the edge of a step is helpful in this exercise because it allows you to get a slight pre-stretch on the muscle, on the gastrocnemius, and then contract as you elevate. So here I'm going into concentric contraction using the gastrocnemius, and here I'm eccentrically contracting the gastrocnemius to lower my body weight. Variations of this movement are single leg, which now one of your legs has to support the entire body weight, so it essentially makes it twice as hard. And finally, we're ready to talk about the soleus. The soleus originates on the upper 2/3 of the posterior surfaces of the tibia and fibula. It inserts at the calcaneus via the calcaneus tendon or the Achilles tendon. As we look at the diagram, in order to see the soleus, we have to cut away the gastrocnemius. The soleus is deep to the gastrocnemius. You'll notice the soleus is a broad, flat muscle taking up the posterior surface of the lower leg. You'll also notice that both of the gastrocnemius and the soleus converge into one common tendon, the Achilles tendon. The action of the soleus muscle is plantar flexion of the ankle. Now, as I said, both the gastrocnemius and the soleus converge into the same tendon. Therefore, anytime plantar flexion occurs, both the soleus and the gastrocnemius are working. However, the position of the knee joint does affect to what extent each muscle is working. For example, in a sitting position with a knee flexed, if an individual performs plantar flexion, the soleus will be performing most of the action. The gastrocnemius is in a position where it has a disadvantageous line of pull. Therefore, an exercise example that works the soleus is a seated heel raise. To demonstrate the seated heel raise, I'm in the sitting position, again with my heels hanging off the edge of a surface. I've added additional resistance by resting a bar on top of my thigh. And I'm simply going to perform plantar flexion by lifting the heels. And again, I've got the surface with my heels hanging off the edge, so I can get a slight pre-stretch before I concentrically contract into plantar flexion. So on the way up, on the ascent, I'm concentrically contracting the soleus. On the descent, eccentrically contracting the soleus muscle group. Well, that's it. That's the end of the exam review video. We've covered a majority of the muscle groups in the body used by personal trainers. I really hope this helps you in your studying. Good luck.